Today we're doing cardiac and pulmonary assessment on our simulation patient William Stone. As always, knock on door, perform hand hygiene, glove, introduce yourself, and use 2 patient identifiers. For past medical history, he has hypertension, hyperlipidemia, and atrial fibrillation. The patient denies any major surgeries. Says he has a family history of coronary artery disease, has no known allergies to medications, and is currently prescribed hydrochloride for home but does not take it. Social history includes no reporting of drinking, a smoker, 1 ppd for 20 years and quit 7 years ago, denies street drug use, married, 3 adult children, retired, and unknown highest level of education or nutrition and exercise. Diagnostic history shows a CMP with elevated BUN, creatinine, and AST, and a low serum sodium. CBC shows low hematocrit. X-ray shows possible pulmonary edema, and the BMP is elevated. For subjective data, we have reports of fatigue that is slightly improving, no skin color or temperature changes on the arms or legs, reports shortness of breath with and without exertion, does not report number of pillows used. Patient does not report chest pain. Frequent cough is present. There is +2 edema bilaterally in lower extremities present, and does not report number of times a week and at night with an urgent need to urinate. For objective data, we have the chest wall is symmetrical and flat. Heart rate is tachycardic without murmur, gallop, heaves, or thrills noted. Crackles noted in the bases of the lungs bilaterally. Pulse is 98 at carotid and 5th intercostal space. No masses or crepitus present on pericardium upon palpation. The aortic, pulmonic, tricuspid, and mitral area are all tachycardic. Apical pulse shows sinus tachycardia at 98 beats per minute. Cough is present with or without position changes. There is no phlegm or blood in sputum. Shortness of breath is present with crackles. Fatigue is present and slowly improving. No chest pain is reported while breathing. No environmental exposures that may affect the breathing. The last known TB test is unknown. Chest X-ray was yesterday, and last pneumonia vaccination is also unknown. Chest wall is symmetrical and flat, anterior, posterior, and laterally. The client's nail, skin, and lip color are within normal limits. There is no chest tenderness, crepitus, or masses present upon palpation. This patient is showing a tachycardia pulse at 98 beats per minute at the carotid and 5th intercostal space. The tachycardia is noted at the aortic, pulmonic, tricuspid, and mitral area, as well as the apical pulse. No murmurs, gallops, heaves, or thrills were noted, but crackles were noted at the bases of both lungs bilaterally. The carotid pulses are bilaterally palpable and equal at 98 beats per minute. No jugular vein distension is present. Now palpating to find the 5th intercostal space at the midclavicular line to find the apex. Now auscultating the aortic, pulmonic, Erb's point, tricuspid, and mitral area.